Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. I have two wonderful guests for you today, one who's been on the show a few times, as recently as a few days ago, and one who is brand new. Their names are Dr. Amy Comander and Dr. Michelle Tollefson, and they're going to be talking about how to pave the way to wellness. Please welcome them both to the show. It's nice to see you again, and it's nice to meet you, Dr. Comander.
Thank you for the opportunity.
Thank you so much.
It's my pleasure. Well, since Dr. Tollefson was recently on, and hopefully everyone saw that wonderful episode, and if they didn't, I'll link to it below. Dr. Comander, who are you and how did you get involved with lifestyle medicine?
Hi, first of all, it's so great to be here. Thank you so much for this opportunity. And it's obviously wonderful to be with Michelle as well. So I'm a breast oncologist here in Boston, Massachusetts at the Mass General Cancer Center. And I've been practicing oncology for a number of years. And actually, I want to say it was back in 2012, I saw a flyer for a lifestyle medicine conference that was being sponsored by Harvard Medical School and held down the street from where I was working at MGH. And I looked at the agenda, and there were topics that were really of great interest to me personally. The importance of exercise, how to write an exercise prescription for our patients, the importance of a plant-based diet, how to counsel patients about adopting this type of diet, etc. And I really had not heard of lifestyle medicine before, but the agenda really caught my interest. So I blocked my schedule and I went to that conference, and really I was so inspired by this field. And that's where I also met Dr. Beth Frades for the first time. And if you know Dr. Frades, she has a lot of energy and enthusiasm and passion for lifestyle medicine. And after that conference, we met and we discussed some ideas that I was interested in pursuing in order to help my breast cancer patients adopt healthy habits after a breast cancer diagnosis. And that's really how I got into this field back in 2012 after attending that conference.
That's incredible. Don't you think, though, pretty much unless it's an accident or a birth defect, that all medicine should be lifestyle medicine?
I mean, I think I definitely want to hear Michelle's thoughts too, but certainly the reason this conference was just so eye-opening for me is, I'm sure you've heard this before, a lot of the nutrition information we learned, the exercise information, how to counsel patients on behavioral change. A lot of this was information I had not really learned in medical school or in residency, and certainly not in my oncology fellowship. So it was very informative. And certainly I think this very much should be part of medical training. And increasingly it now is. And Michelle, I'm interested in your thoughts too, of course.
Yes, no, I completely agree. I think it's been in the literature, and now we just have more and more literature coming out supporting what we've known before, but also it's really being emphasized. The guidelines have often said that a lifestyle changes or lifestyle modification should be a primary treatment for many of our lifestyle related diseases, yet it's often been kind of pushed to the side. So I think it's exciting that our lifestyle changes can really be kind of the foundation of health that we advocate for our patients, while also including conventional treatments when appropriate. They work beautifully together.
That's fantastic. Well, you along with the doctor you mentioned, Dr. Frades, you guys wrote a book together.
We did, yes. And that was a real fun adventure and a wonderful collaboration that we're continuing to work on.
You want to tell us a little bit about the book, and we can also link to that if you like.
Sure. So we actually wrote the book during the pandemic. Dr. Beth Frades and Dr. Amy Comander, they both live in Boston and I live in Colorado, but we were able to do all of our work on Zoom. So every week for about a year or so, we would meet on Zoom and we would write this, and we wrote this book. So it was collaboration between the three of us, but based on the work of Dr. Beth Frades. She started the Paving the Path to Wellness program, I believe in 2012 at Spalding Rehabilitation Hospital with stroke survivors and their caregivers. So she was doing these in-person group sessions where they would go over the 12 foundational steps of paving steps. And she noticed significant changes in their health, their overall well-being. So she continued to offer more and more of these sessions. And then eventually she got connected with Amy and they took it from there. Do you want to kind of tell the story beyond that, Amy?
Sure. Yeah, this program is so powerful, and that's why we're so excited to talk to you about it. But when I met Dr. Frades at that conference, again, back in 2012, I'm a breast oncologist. I care for men and women with the diagnosis of breast cancer, and certainly I'm very interested in helping my patients optimize their health after completion of primary treatment during that survivorship phase of treatment. And I noticed a lot of my patients, unfortunately, were experiencing weight gain after chemotherapy. So when I met with Dr. Frades, I noted, I want to start a weight loss program for my patients, and this is what I'm going to do. And what do you think? And she was like, whoa, slow down. She was explaining to me that management of, for example, obesity or other types of problems such as this, it's not just the diet. You have to think of the whole person, as we'll explain, all the different aspects of their wellness, not just the weight, the sleep, the exercise, the nutrition, the stress management. We'll explain all of this today. And she said, that's really how you address these problems in an individual. And that's when she did tell me about the PAVING program, which she had started for stroke survivors to help those individuals optimize their health and well-being after a stroke. And we initiated a collaboration at that time to offer this program to breast cancer survivors. And that's really how that started, a number of years ago.
When you say this program, do you mean the Paving the Path to Wellness program?
Yes.
Well, can anyone take that program? Is it in person? Is it virtual? Please talk a little bit about it.
Sure. So initially the programs were all in person until the pandemic. Amy, wasn't that your first virtual program? So
right. Yeah, we were in person until March of 2020.
Yes.
Yeah.
And I finished chemotherapy. I'm a breast cancer survivor. I finished chemotherapy on Valentine's Day of 2020. And I was telling Dr. Frades, I was telling Beth that I had joined a survivorship program that really didn't feel right to me. It made me feel, it made me feel very down, or that it wasn't very uplifting or very forward moving. So it wasn't the right program for me. So I was telling Beth this, and Beth said, you should try joining Amy's program. Amy's program had just gone online to Zoom with the pandemic. And so she connected me with Amy, and Amy allowed me to join her program a few weeks in. And I thought, I don't really have a lot new to learn. I thought I know a lot about nutrition and exercise and stress and sleep. So I felt like I wasn't sure that I really needed the program, but I would do anything that Beth recommended. So I joined Amy's program. And in addition to falling in love with Amy and her way of presenting material and creating a group that really supported one another, I learned more about the pillars of attitude and purpose and variety and investigation and goal setting, and those things that we don't often talk about. Usually there's just the focus on nutrition, exercise, stress, and sleep, which are all vitally important, but there's so much more to overall whole health. So I fell in love with Amy's group, connected with the other breast cancer survivors and with Amy. And when I was done, I think on the last meeting, I was saying goodbye to everyone and got teary because I realized how much this program had meant to me and the power that it had. Even if somebody had had the skills and had the knowledge that they thought they needed, how powerful this really was in that group and that community. And so after that, that's when I believe Beth invited Amy and I to join her in working on advancing her program that she initially started, that Amy had been doing, and to start working on that book collaboration. So it was really that journey that brought us three together and led to the book.
Nice. Can people watching, if they wanted to take the program, since it is virtual now, take it?
That's a great question. And certainly at present, I'm still continuing to offer this program to a group of breast cancer survivors through the Mass General Cancer Center. And our program has great interest. In fact, we have such a long waiting list just at my hospital. That's a challenge that we're facing right now. It's a good problem to have, but this information is desperately needed, certainly by my patient population. But I do think all individuals would really benefit from this information. So as Michelle and I can tell you, along with Beth, we've made a beautiful website, if I may say that. And I was just looking at it earlier today and just amazed at how nicely it came together, where we provide really great information and an overview about the PAVING program with a link to the workbook. And one of our goals now is we're really thinking about strategically, how can we make this program more available to others who can join, whether online or in an in-person group virtually. I mean, this virtual world, as you know, has really opened up so many possibilities for innovation. So we're really thinking hard about that now. How can we best reach more people? And Michelle, feel free to add more.
Sure. So yes, I'd encourage all of you to visit our website at www.pavingwellness.org. Paving the Path to Wellness is a nonprofit 501c3 organization. All of the proceeds, all of the author royalties from the book, all of that goes not to us, but to the Paving the Path to Wellness program if you happen to purchase the Paving the Path to Wellness workbook. But we do realize that there's such demand for this. And although Beth, Amy, and I have offered the Paving the Path to Wellness sessions, we realize that the demand is far beyond what we can do as 3 individual women. And so we're developing a leader training program where other healthcare providers will be able to go through a training process so that they can deliver the Paving the Path to Wellness program as well. We'll also be offering some options where people can join online groups. We don't quite have those ready to launch yet as far as bringing together people from all over the nation and all over the world. But if you want to be on that mailing list to know when those do go live, you can go to that website and there's a contact area where you can put in your information and we'll reach out to you. So if you're a healthcare provider and you're interested in learning more about possibly being a leader once our leader training program rolls out, or you're interested in just learning more about paving or in taking an online group, please reach out and let us know because we'd love to connect with you.
Nice. Hey, Dr. Comander, I'd love to know a little bit about when you first discovered a plant-based diet and started following a plant-based diet.
That's a great question. And I'm very passionate about my interest in plant-based diets. In fact, I just got a new cookbook. It's right here. I was showing Michelle yesterday during one of our meetings. It's the Be a Plant-Based Woman Warrior by Jane Esselstyn and Ann Esselstyn. I haven't made anything from it yet, but I love it. It looks beautiful. A colleague recommended it. So I would say my whole life, I've actually never been a fan of eating chicken or meat. It's just really something as a kid, my parents would strongly encourage me to do so. But I just never really liked it. I always gravitated more towards eating fruits and vegetables my whole life. And so I guess it was more maybe, again, during college, medical school residency that I just realized I wasn't really eating, those types of foods any longer. And I was really eating more of a vegetarian type of diet. And it's funny, a number of years ago, my daughter's now 15, but when she was 9, she proclaimed she was a vegetarian as well. And she had her reasons for that. And so I've been supporting her as well in this effort. She's growing, and I did a lot of research on children and nutrition just to make sure she's getting all the nutrients, calcium, protein, et cetera, that she needs. So it's been a good learning experience for both of us. But I'd say my husband's pretty much plant-based, not 100%. My son, who's 13, he's evolving, put it that way. But definitely, I feel like it's such a interesting and fun way to cook. And that's why I'm excited to try out this new cookbook too.
Well, it sounds like most of your patients are dealing with cancer. Do you ever recommend a dietary change in general or a plant-based diet specifically to them?
Right. So, certainly with the paving program, those who participate, we really, as Michelle's alluded to, everything is, one step at a time. There's so many changes that people try to make in their health for good reasons after a diagnosis such as cancer or a stroke or another serious medical condition. And sometimes making all of those changes at once can be very overwhelming. But certainly we do discuss strategies when we get into nutrition about how to incorporate more fruits and vegetables into one's diet, and what are some of the great plant-based sources of protein that are out there, because this is certainly a challenge for many people who have never explored it. So we also really love offering like a cooking class, which we used to do in person. Now we're doing them virtually. And I know you do a lot of those too, and I can't wait to explore them further, but to really help individuals learn that it's not that hard to cook, creative foods with tofu or other plant-based options that are out there. So it's definitely a work in progress for many people, but I would say many of the individuals who have gone through the paving program are eating more of a plant predominant diet.
That's great. You wanted to say something, Dr.
Yeah,
Tollefson?
I was going to say also, I think it's wonderful with the paving program that it's not just nutrition, but it's that we surround nutrition with attitude, thinking about our attitude toward food, toward trying new foods, a growth mindset. We talk about variety, trying a variety of different foods, not just what we're used to, but really going out there and exploring different things and having fun with that process, as well as investigation. That's one of the 12 pillars as well, investigating what works for me. How do I feel when I try these different types of food? We investigate purpose, or we look at purpose. And so also trying to set nutrition goals that align with one's purpose. Why am I doing that? We know that there's science around that we increase the chances of a healthy behavior change when it aligns with our purpose, teach them about goal setting. So all of these things really come together beautifully. So even though nutrition is one of the 12 steps, I would say it's often the most, the one that intrigues our patients the most, or they want to learn the most about, but it's really all those other pillars too supporting it that make such a difference.
Yeah, I think that's such a great point because, I think all of the steps come together to really help individuals adopt healthy habits, whether it's nutrition, exercise, all the topics that we discuss in the program.
Molly, who's watching live, said, have you ever heard of black seed oil for cancer reversal?
I have to say I have not heard of that. So I'm sorry, I would have to look that up, but I honestly have not heard of that particular product.
Okay, well, thank you.
As Michelle has.
No, I haven't either. I wonder if, before we go any further, I wonder if it would be useful for your viewers to have us say what the 12 steps are. So we have an acronym that goes along with PAVING and then STEPS, which has an extra S at the end. So I'll go through those. P is physical activity. A is attitude. So really exploring your attitude and how that supports your overall well-being. V is variety. I is investigation. N is nutrition. G is goal setting. So there's paving, goal setting. And then the steps is stress reduction or stress management techniques. T is timeouts or taking time for oneself, which we know as women is hard for us to do. So really trying to focus on taking time for ourselves to focus on our well-being. E is energy. So we often focus on time management, but do we think about energy management? So how are we managing our energy? What do we need to do to increase our energy and feel good? So STEP, P is purpose. And then there's two S's at the end, one for sleep and one for social connection, those strong interpersonal relationships. So those are the 12 steps. When we do the program over 12 weeks, we cover one of those steps each week. Sometimes we do a condensed version where we do a 6-week class. We might be doing 2 of those a week. And in our book, we go through those steps. So it's like an introduction, a conclusion, and then the 12 paving steps in the middle.
Nice.
Yeah.
Now she's clarifying black seed oil, something called soursop tea. Have you ever heard of that?
I'm sorry, I have not.
Yeah.
But thank you for clarifying. I can look it up after this. But
Okay.
Michelle, that's so great that you outlined the program because it really is each of these steps. I'm doing this because it's like a wheel. We do actually have our participants fill out a wellness wheel with some questions, not too many, before they do the program. And at the end, where individuals can kind of see where they stand on some of these steps that Michelle has outlined. And of course, there's no right or wrong answers. Some of us are amazing when it comes to exercise, but maybe not so great when it comes to sleep. Who could I be talking about? So, there's so many, it helps individuals identify the opportunities for improvement that a person might want to work on over the course of the program. And the social connection piece, which Michelle noted, the final S, is so important. And I think I didn't even realize how important that piece was when I first started the paving program. As Michelle noted, bringing this group of, in my case, women who've gone through breast cancer treatment together, supporting one another in making these behavioral changes was truly amazing. And many of the participants in my previous groups have really bonded and continue to meet on their own, whether it's on Zoom or in person or in a park, to continue to work on supporting each other and adopting these healthy habits that we learned about in the paving program. So it's a really, really powerful program, and the social connection makes it even more rewarding for the individuals who participate.
Nice. Susanna, who's watching live, made a really good point that wouldn't it be great if there was this information in a program that could be used preventatively as well? Because it sounds like so many people wait to make changes until after a diagnosis instead of before.
I 100% agree, and paving can be used before a diagnosis. Even though Dr. Frady's originally created it for stroke survivors, and we've used it with certain populations, it can 100% be used preventively. The workbook is general enough that it's not just for stroke survivors, not just for breast cancer survivors, but it is a general book that you can go through. It's 400 pages and it's a workbook, but it's not all a workbook. And there's also a lot of just deep content as well, but places to reflect. And so it can be used by itself, both preventatively, and also if somebody has a chronic condition. And I think even though, as Amy mentioned, that social connection piece is so important, you can get a lot out of the book, but I think actually being in a group is probably the optimal way to get the total experience. Dr. Beth Frades is one of the first physicians trained as a wellness coach, and she uses a lot of the behavior change theory and how to really work with people to get them excited to want to do the behavior change. And with Amy mentioning the wellness wheel, which you can actually get access to for free on our website if you want to go take that wellness wheel yourself. But Dr. Frades is always saying no shame, blame, or guilt. Meeting people where they're at, help them to have fun with that behavior change, to learn and grow and move forward.
How is the Paving the Path to Wellness program different than other health and wellness programs that people might have heard of?
Well, I do think it's actually very different. As someone who's taken a strong interest in this area since I discovered lifestyle medicine, I've checked out a lot of programs, and I think Michelle's already explained a lot of the aspects that I think make this program very distinct quite well. We talked about, physical activity, stress management, sleep, nutrition. We all think of that when we initially think of a wellness program, but what we may not think of is what is the role of one's mindset or attitude? What is variety? What is investigations? How do we truly make behavioral changes? What is the science behind goal setting? And one of the most important aspects of this program, which makes it very unique, is we really dive deeply into what is purpose. And that's a really hard one, I have to say, in my experience in leading the groups that I've led so far. What is an individual's purpose? And for some of us, that may be an easy thing to say, like, I'm a doctor. My purpose is to take care of patients and heal them and help them thrive. But for some people, that's a really hard one. What is my purpose? Maybe someone's job doesn't fully align with their purpose. So we do have a lot of information in the workbook about how one can figure out purpose, but it is a challenging one, but I think so important for our overall health and well-being, and definitely a very unique aspect of this program that I have not seen in other programs. And Michelle, I'd love to hear your thoughts about that too.
Yes, I 100% agree. And I think it's exciting. Like I knew about having a good, or I'd heard of having a good attitude or about goal setting, but really to dive into the research and to see what research is out there on attitude, on growth mindset, on self-compassion with Kristen Neff's work, what research is out there on achieving a state of flow when you're really like lost in the moment and you're doing something that you enjoy. How does the research on variety or investigations, how does all of that help me with my healthy behavior habits that I practice every day? So I think that as a scientist, as a clinician, as a physician, that science is fascinating and it's fun. It's fun. Like, even though, I can read all the information on why eating more plant protein is beneficial. And I love that research. But when I look at the research on attitude or investigation or on how purpose aligns with behavior change, I get really excited about that too. And I think that's what makes this program that was originally started by Beth so powerful, is that it's based on evidence, but that it's whole health. It's not just about the body. It's about mind, body, healthy body, peaceful mind, and a more joyful heart is what we say about the Paving the Path to Wellness program. And really all of those aspects are important when we're working with someone.
A few of the live viewers are commenting that a lot of what you're saying sounds a little bit like the blue zones, and Dr. Comander had mentioned finding purpose. And I always hear about that ikigai that they talk about.
Mm-hmm.
Yeah, definitely. That concept, it's a Japanese concept of thinking about, which is very much aligned with one sense of purpose. And certainly we discuss that work when we discuss purpose. In fact, I'm sure, Michelle, you can probably tell me what page it's on in the workbook that we have that graphic that really explains it. But you're absolutely right. As you can understand, like in the blue zones and in other cultures, this sense of purpose has really been identified as key for living a fulfilling life and associated with longevity. And therefore, I really would encourage your viewers to really think about that question. And it is a hard one for many people. I just want to acknowledge that too.
That's great. Let's see. Well, how can the people watching today benefit from this program, especially if they're not able to take it right now?
So I would say consider getting the book. Once again, all the proceeds go back to the Paving the Path to Wellness nonprofit organization. Our publisher is Healthy Learning, so you can look at healthylearning.com, and it's carried on Amazon as well. And the book looks like this, so Paving the Path to Wellness workbook. So consider getting the book because you can go through. There's a lot of great a lot of great information. There are places, there's a lot of content, a lot of really good content, but then there's also places to reflect upon the reading. And like this is about reflection time. Is there a behavior that you're contemplating changing? If so, what is it? And it walks you through the various steps. So that evidence-based, but places for reflection. So I think you can benefit there. Even if somebody doesn't want to get the book, I think you can go to the pavingwellness.org website and benefit from that. We try to explain, not in as much detail as in the book or in the program, of course, but we try to explain what those 12 steps are and just give you a little kind of snippet of why attitude is important to overall well-being, why variety and investigation and purpose and goal setting. So there's some information on there. But I would say if you don't get the book or don't take the class, consider going to the website and taking that quiz, the paving wheel survey that Dr. Comander referenced, because I think that you can learn a lot from that, learn where you're at with some different behavior practices, and then also see what calls to you. Just Dr. Frady says you don't have to start at what has the lowest score on your paving wheel, because we go through all of the 12 dimensions. But it might be that you fill this out on variety and you're like, that really calls to me. I really want to incorporate more variety into my life. I realize that I'm doing the same workout routine every day. I realize that I'm eating the same foods over and over. I realize that I'm meeting with the same people and I want to add variety. And so it might be that you want to reach out to some friends that you haven't connected with in a while, or try some new, maybe instead of running around the block, you run on a different path or trail, or you try some different types of ethnic food. So you can take that quiz and you can see which areas call to you and then work on those areas. So I would say go deeper with the book or with a program, but even just going to the website, I think there's some beneficial content there that hopefully you would enjoy.
I think that's
go ahead.
I was just going to add one thing. I think that's a great answer. It's funny. I'm thinking of one anecdote. When our book first came out, Dr. Frady's had a group of women that she's close with where she lives, and they all were so excited to get the book. And actually they met together as their own group. They didn't really have a leader per se leading them, but they went through the workbook together and sort of discussed the topics and the questions with one another. And obviously gave us some feedback on the book too, which was great, which we always welcome, but they really enjoyed working on it together. So you can imagine, I'm sure many of your listeners and viewers are part of book groups. I know many of my patients are in multiple book groups, but this would be a really fun type of book to work on with a group of friends who are all motivated to improve health. Because I think the questions are already there. You don't have to think of them. And there's lots of opportunities for all of us to improve our health.
Right.
It's a great idea.
Mostly the people that took the program, were they breast cancer patients, or did other individuals take it with other perhaps diagnoses, or maybe even just for wellness?
I mean, I can tell you personally, I've been offering the program to breast cancer survivors, but I know the program's now been offered to a wide range of individuals. You know, Dr. Frady started it with stroke survivors, but over the course of this unfortunate time of the pandemic, there's obviously been a real need in healthcare workers, nurses, doctors, you name it, various different professions. As we unfortunately know with burnout, it's been a major challenge, obviously not just in the healthcare industry, in other realms as well. And so I know Dr. Frady's and Dr. Tollefson have been involved in offering paving to those groups too, to help address that issue. So I really do think this could be offered to many different populations. And Michelle, feel free to comment further too.
Yes, yeah. I know it's been offered to various organizations who wanted to work on workplace wellness or worker well-being. And then yes, the healthcare provider is such an important area. And I offered a class for breast cancer survivors, which was exciting as a breast cancer survivor myself. But as an OB-GYN, my area of real expertise is menopause. And so when I went through treatment for breast cancer, I went immediately into menopause and had a whole new appreciation for those symptoms that I had discussed with my patients for years. And so next month, I have a book that will be coming out, or that we have a book that will be coming out, Dr. Frady's, Dr. Comander, and I, on paving for menopause, midlife, and beyond. And that really is intended, it can be preventive for people who want it to be preventive, or it can focus on menopausal symptoms for those who want to work on that. Or for those who have chronic conditions, it'll take all of those 12 steps as well, but really focus on applying them to the woman who is going through menopause or who is beyond beyond menopause, because there's a lot of commonality there. So that will be coming out, and women are welcome to join those groups as well. Just reach out online if you're interested. I don't know for sure what it will look like, but I would love to lead some groups with some of your listeners that are out there and want to join groups. So we'll be working on that in the near future. After I finish this book, I'm just finishing touches on it, and then that's my next thing to tackle.
I think it's amazing. I'm so excited for this to come out. And there's a real need for this information. I'm sure you would agree that it's just women are looking for this information, and it's really amazing.
It is. I was surprised as a menopausal woman how little evidence-based research was out there, or easily accessible resources there were on menopause and lifestyle medicine. So it was actually Beth Frades who convinced me, because I said, I'm done writing for a while. And she said, there is a need for this book. And I said, okay, well, if I get to do this with Amy and Beth, then it is a project that's needed. So,
when you do your Costa Rica trip, will you implement some of the teachings in this program, maybe with the individuals attending?
Well, there's so much overlap with lifestyle medicine that it's hard for me to talk about lifestyle medicine pillars without incorporating some of what I've learned from the PAVING program. But it won't specifically be on the PAVING program. We've talked, though, who knows, we may offer trips in the past where we focus on paving the path to wellness trips, but we don't have that quite planned yet. But stay tuned.
Do you have plans to expand the program?
The Paving the Path to Wellness program?
Yeah.
Yes, we sure do. So we know that we need to train others, because we know there's such demand. Amy has a long waiting list for her breast cancer survivors who want to join. So we're looking at how we can train more trainers, because even though we love offering these groups, our goal really with a nonprofit organization is to reach as many people as possible. As clinicians, we see the need for this. We see that people are hurting, when we see the tremendous benefit. Like, it's when I went through I wasn't excited about the program when I'd heard a little bit about it from Beth. When I went through the program personally, that was when I became excited about the program. I was like, what can I do, Beth? What can I do? How can I do more? So I think as we've seen those life changes, as we've heard from our participants, their significant life changes, it's made us realize the need to get this out, and to get this out on a really large basis. And that's where we need other healthcare practitioners who want to learn to be paving leaders, so that we can spread this far and wide. Amy, I'd love to hear your thoughts too, though.
No, I fully agree. And that's such a great question, Chef AJ. Just at my own hospital, MGH in Boston, I have a long waiting list, and there's only so many people that I can serve with this program. Even now, I have other individuals running it, and we're doing it at a nearby hospital as a collaboration with an underserved patient population as well, which has been really rewarding and beneficial for them too. But how can we get this information to other, I'm just going to focus on breast cancer for now, but of course I really mean to individuals with all kinds of diagnoses, or healthy people who really want to continue to strive to improve their health. And that's why, as Michelle noted, we're really excited to start the next phase of training other healthcare providers to lead these groups. And that's why I put a message on the website, because that is sort of the next phase that we're currently working on to help train other individuals, so we can broaden the reach of the program.
Great.
Ideally, I think, so I might be biased, but I think everyone could benefit from this program.
Totally.
It would need to be modified, of course, for teens, but I think it's something where anyone learning these about the different pillars and the components of paving steps could benefit. So we really do. That's why the impetus behind setting up the nonprofit organization is so that we really could help spread this globally.
Right.
When I first did the program or learned about it through Beth, I was like, wow. And I really have made a number of changes in my own, health, I guess you could say, since starting the program. And I'm a doctor. I've learned a lot of this stuff in med school, but it's been really, really life-changing for me as well.
Yeah. And it's being translated into Korean, I believe, as well. So it is spreading. It's spreading. We have some practitioners who are learning to do it, who are in other countries. And the need isn't just in the United States. It really is global.
For sure. Definitely.
Renee says, could it be used for other cancers? But it sounds like you answered that. And Molly wanted to know, the workbook you showed, or the book you showed, is it available in Kindle?
Great question.
I'm not sure. I think it's available as an ebook, but we can ask our publisher.
I know it's an ebook for sure,
Yes,
through
yes.
Healthy Learning, but that's a great question. It's on the Kindle. That's something my kids would ask. So that person asked a good question. They love their Kindle. Everything's on the Kindle. I'm still a hard copy kind of person.
I know I'm a hard copy person too, especially
I know,
writing in
Michelle,
that.
you and I share that love for having a million books around, but my
That's
kids
right.
are all about their Kindle. So I love that question, and we should know that.
We'll look into it. We'll get back to you.
And people are asking, when will the menopause book come out? Do you have a name for it already?
Oh, we went back and forth. Yes, we do. We went back and forth between a few different names, and I'll look up the official name for you. I should know that by now, but yes, it comes out next month. So in mid-October is when we're planning that it should be released. By November 1st at the very, very latest. We are so close, and it's in color. It's in color. So I'm actually doing the final proofs this weekend, looking over it to make sure that it's as perfect as can be. And then I'll give it back to the publisher. And then hopefully in a little over a month, it'll be available. Healthy Learning will have it first. Eventually, I hope that it's on Amazon as well, but Healthy Learning, the publisher, will have it as soon as it's out there. Or if you want to get on our website and sign up, we'll let you know when it comes out as well. And then all the proceeds from that book too go to Paving the Path to Wellness, the nonprofit organization, not to the three of us who are authors. And even though I'm the lead author on it, it's a book by the three of us, Dr. Beth Brady's, Dr. Comander, and I. We really are a team when it comes to collaboration and working on these and getting them out there.
I just want to add too, I'm so excited about this personally because the book is gorgeous. I mentioned it to some of the women who've already done the paving program in the breast cancer groups, that I mentioned that there will be this book coming out on menopause and a group eventually. And no matter who I told, they were like, sign me up. I want to do it again. So that really is a testament to the power of this program. Like once you do it, you want to do it again. And maybe, they were just pleased. As soon as Dr. Tollefson's opening that program, I am in. So it really is amazing, and really also just exemplifies how lifelong learning is really important for all of us as we're trying to make changes in our health. And, it's not a quick fix. 6 weeks, 12 weeks often isn't enough time. So that's why, they were all on the same page. Like, I want to be in that menopause group because, a lot of the women, unfortunately, after breast cancer treatments for various reasons, do have early onset of menopause. And that's why this was of great interest to them.
And Diana says, can she pre-order the menopause book?
Ooh, that is a good question as well. I don't know. I don't think it's up for pre-order on Amazon, but if you can reach out through our website, we'll get more information to you. And let's see. I'm still looking for our final cover of the menopause. So the official name is Paving: A Woman's Path to a Healthier Body, a More Peaceful Mind, and a More Joyful Heart through menopause, midlife, and beyond. So that's the whole title. So it's Paving, but with that focus on menopause, midlife, and beyond.
I love it. And I will say, obviously, this is just such a beautiful book, but it very much complements the Red Workbook too. So there's so much new information and great evidence-based information that is in it, but it really is a complement. So I think if someone watching this or viewing this already has the Red Book and they're like, do I need this? I will say this is a really special book that Dr. Tollefson really took the lead with, and it's truly amazing. And it's in color. I love that.
Also, we get into, thank you, Amy. Also, we get into some topics that aren't commonly discussed, but as a gynecologist, I'm somebody who thinks that we should be talking about genitourinary syndrome of menopause, which is vaginal dryness, which happens, which is a natural part of going through menopause as our estrogen levels decrease, but it's something that we often don't talk about. As a gynecologist, we see it all the time when we talk with our patients about it, but I've seen that so many women struggle and alone, or think that they're one of the only people. And so I tried, in addition to the 12 components of paving steps, I also dove into hot flashes and what are the evidence-based lifestyle practices that can help with that, or brain fog, or aches and pains. So we get into some of those other symptoms that often go along with the menopause transition and postmenopause. So
give us something though, give me something for the viewers, what they can start doing, those that are suffering with symptoms.
Sure. So many of the things that we recommend for just overall health and well-being also help with menopausal symptoms. So for example, eating eating soy or eating phytoestrogens. There's some good research out showing that that helps some women, maybe not all women, because when we think that that's because of the differing microbiomes, the gut microbiome and the bacteria that we have. So we're still trying to learn more about that. The gut microbiome is so complex, but engaging in aerobic activity has been shown to help with hot flashes and night sweats. And even separate from that, there's research on resistance training, which I wasn't expecting. I wasn't expecting to see literature specifically on resistance training separate from aerobic activity that's beneficial for addressing hot flashes and night sweats. And I'm somebody who does not gravitate naturally toward lifting weights. But when I read this, I think I need to do some resistance training. So I actually have some stretch bands right here in front of my desk, and I'm trying to do a little bit more of that. Prioritizing sleep. Sleep gets more difficult as we age. We know that deep sleep decreases, but really working on our sleep. And there's some really interesting research about things such as like a drop in core body temperature that can help us with getting more deep sleep as we age and go into menopause and beyond. So like taking a warm bath or a shower, or even just keeping our feet warm at night. So putting on some extra socks, it helps with decreasing our core body temperature, which then helps us to achieve deeper sleep. So there's just some really interesting things that I didn't know when I came about it in the literature. I knew a lot of the literature already, but it was really fun to dive into. Managing stress, we know often that the hot flashes can be triggered by stress. So doing some different techniques can address that. There's some literature out there as well. And also with nutrition, like the sugar crash, that can sometimes trigger hot flashes, sometimes spicy foods. So I always recommend that my patients do a journal, because it's often challenging. We're so busy during our day to really focus on what may be leading to those hot flashes. So at least for hot flashes, I like for patients to do a symptom diary and see, is it certain times of day? Is it after they have something with that caffeine? What is it that might be triggering it? So we go through a lot of different conditions, but that's just a little, I guess, around hot flashes and night sweats.
Apple saying, could Dr. Tollefson come back to share her book when it's released? Yes. In addition to things that they can do to alleviate some of these symptoms, aren't there certain things that they could do to make them less pronounced? Like, for example, I hear that things like caffeine and alcohol are not so great for menopausal women that are having symptoms.
You're correct. Caffeine and alcohol can definitely be a trigger for hot flashes and night sweats in some women. Even with caffeine, it can be right after, and sometimes it can raise. Caffeine takes several hours to really clear, and so it can raise the incidence of hot flashes during that time. So people are more susceptible to being influenced by that caffeine and alcohol than others. But yeah, for sure, that's a great point one of your listeners made.
Great, thank you. Mary says, I'm very interested in how to become a medical provider.
That's wonderful. Great. We're so excited for the PAVING program, I'm thinking.
Yeah, that's what I'm thinking, is she's saying.
Yeah, I mean, as Michelle noted, on our website, pavingwellness.org, there is an area where you can send an email that does come to us, and you could express that interest. And right now we're creating a list because we're actively developing a program now to help train other healthcare providers to lead these groups. So thank you for your interest.
That's great. Also, so there's kind of the two main components, I would say, to being a leader. Dr. Frades, Dr. Comander, and I, we love leading these, but part of it is really that we love interacting with a group and getting a group together that really grows together, that really supports one another. And so we're creating a training class, a continuing medical education class. We're creating a class that's compassionate communication for connection, because there really is a lot of evidence behind how we use some of the different competencies and techniques in the wellness coaching field in order to increase the chances that somebody successfully makes the behavior changes that they want to make. So we have that component. And then also it's important to us that people who are delivering the program, that they also have the basic content knowledge around lifestyle medicine. So our pillars of lifestyle medicine, I know that we've talked about before, the nutrition, physical activity, stress, sleep, social connection, and avoiding or eliminating risky substances. So there'll be some content that we need to make sure that people who deliver the program, that they have there, and then also with that connection piece. But that's what we're working on that now. We just finished the leader manual. So we're working on all of those different pieces, and we're really excited to have people like your listener who are interested in joining us.
Definitely.
So the 12 steps, can you put them in like hierarchical order? Are there some that are your favorite or that you feel are the most important for someone to start with?
That's such a great question, because obviously Michelle and I'm speaking for you, we think all of them are important. So I know I was trying to think about this. If I had to pick a few that are the most important, I mean, it is very challenging, but one of them does again, surprised me when I led my own group. I don't know why it surprised me, but I did. The social connection piece is so important. And I feel like what we've all been through since March of 2020, where a lot of us were quite isolated, many of us with our families, but many individuals really isolated by themselves, not going into work, not really connecting in the ways that we're used to. That's really had such profound impacts in so many different ways for certainly for overall well-being and health. So I do think the social connection, the importance of that has really been emphasized by what we've experienced through the pandemic. But I will say, I do think all the other pieces are so key too. One of my favorites, of course, is physical activity. I'm a marathon runner. If I did not run, you don't want to be around me. So that one is really key. And I love to express my passion for physical activity to the individuals who do my group. And certainly we've seen some really, I'm not expecting people to be marathon runners, by the way, but we've seen a lot of individuals adopt exercise habits over the course of the program, which has been really rewarding. So I'd say the physical activity piece, the social connection piece, and then I have to add attitude, mindset. And I know we've talked about this a lot in the course of this session today, but how we view whatever it is, whatever challenge we're experiencing, the pandemic, trying to lose weight, trying to exercise, trying to sleep more, interactions with friends and family members, our mindset is so key. And therefore, diving into the literature about the importance of attitude and mindset has been really interesting to me. And I think the group individuals who participate in the PAVING group have loved it as well. Michelle, I'm going to let you take over on your favorites, which I know are really hard to identify.
No, I agree. Attitude was the one I picked first. So I actually opened up to this in the chapter, and the chapter starts off with this quote from Winston Churchill. Attitude is a little thing that makes a big difference. And I love that. So some of the areas that we get into with the original PAVING book and attitude are automatic negative thoughts. Those thoughts that we have, often we're our own worst critics. We say things to ourselves that we wouldn't think of saying to a friend. So really thinking about how our self-talk impacts our wellness behaviors and our attitude, looking at the various parts of attitude, positivity, the positivity ratio, and some different work on positivity by Dr. Barbara Fredrickson, that is covered, as well as Carol Dweck's work around mindset, the new psychology of success. We also have some information on gratitude. There's a lot of research on gratitude. It seems like it's such a simple thing. How could an increased focus on gratitude really make a difference? But there are some really powerful studies on how incorporating gratitude, whether that's a gratitude journal. When I drive my kids to school every day, they know they can't get out of the car until they think of at least 3 things they're grateful for. So we go around and do that with some really interesting research on gratitude. We cover Dr. Martin Seligman's work on PERMA, the 5 building blocks of wellness, and also his work on signature strengths, really looking at our strengths, really looking at our values and how that contributes to attitude as well. So I would say a mindfulness, just all of that. So yeah, so I think attitude is probably my favorite. I mean, I love all of the pillars. Nutrition is always fun to teach because there's so much interest. I think when people start learning about the power of food is to impact their overall well-being, I think that's just, it's so amazing. And so I think that's something that your listeners probably already have a good understanding of. Chef AJ is the power of nutrition to really impact our lives. But that's always a powerful pillar when we're offering the program too. And it's neat to meet people where they're at. In a class, we typically have some people who, maybe they are eating the standard American diet, and then we have other people who are eating really healthy, but want to know how to take it to the next level. And so we try to meet everybody where they're at and to look at how we can help them move in that direction. And I think we may even have a PAVING cookbook coming out eventually. So
Stay tuned.
Yes, stay tuned. Stay tuned. More coming.
Nice. People are asking, what can we do for vaginal dryness?
So vaginal dryness is it's a tough issue. And with vaginal dryness, it really usually is due to that decrease in estrogen. And so some people choose to use vaginal estrogen. I know hormone replacement therapy can get, it can get kind of scary when we talk about it, because there definitely are risks of hormone replacement therapy. But the risks of systemic therapy, if somebody is using like the pellets, or if somebody is taking something orally or transdermally, so like with a patch, or so those, you get the hormones throughout the whole entire body. Your cells are seeing that throughout. Whereas if we deliver estrogen just vaginally, A little bit still gets absorbed systemically, and it is not right for everyone, but we can see tremendous change with that vaginal estrogen. So first of all, I try to let them know that the risks aren't the same, and that if they are open at all to considering vaginal estrogen, to talk to their doctor. There's also some other non-hormone prescription medications that are appropriate for some people. So I recommend that they have the hormone discussion with their doctor if they're open to that at all. However, we know that vaginal dryness, we can't fully reverse it, but we know that part of it is due to the health of the the vessels, of the pelvic vessels. And so we know in men, if somebody has a disease, or if somebody has their blood flow to the penis is not as healthy as it should be, they can have an increased risk of erectile dysfunction. So there's a lot of research around that. However, the same thing happens in a female. If the vasculature isn't as healthy in the female pelvis and the blood vessels supplying blood to the vaginal tissue, then we know that the vagina is more dry. And so we can see that in people who have atherosclerosis. And so really working on doing everything we can to keep our vessels healthy throughout our body, right? We want them healthy throughout our body, but when we're working on vascular health throughout our body, it also helps the vessels in the female pelvis as well, and can help to some extent with vaginal dryness. Usually you can't reverse it all by itself. There's some research out there on soy products. So your phytoestrogens. So once again, your soy products, your minimally processed soy. So tofu, tempeh, edamame, miso, using some of those products. So like I personally try to get a serving or two of soy in a day in some way, whether that's my soy milk or my tofu. So I recommend trying that. Exercise, once again, that's going to keep the vessels in the pelvis healthy as well. So regular aerobic activity and exercise. Those are some of the things. And I also discuss some things in the book that aren't typically discussed, such as genital vibratory stimulation. And that's something that is not commonly discussed, but as we age, there is less blood flow. And so doing things like Kegels, where we tighten and relax those muscles, that helps blood flow as well. But also some women, especially if they have vaginal dryness, some women will use genital vibratory stimulation, or a vibrator, that we consider a medical device. It's actually a medical device when used for certain medical purposes. So I discuss that in the book, even though that's not commonly discussed. And then also vaginal moisturizers, such as, well, there are a lot of over-the-counter ones, but then you can also use like coconut oil, some different vaginal moisturizers that can be used regularly, as well as vaginal lubricants, because genitourinary syndrome of menopause often makes vaginal intercourse uncomfortable due to dryness. And so I recommend vaginal lubricants as well. But I get into that pretty thoroughly in the chapter because it's something that it is such a common question. I just feel like it's not discussed enough. So I dive into it. I dive into it in the book.
Thank you. We have a question from a live viewer named Betty, who says, I became vegan 18 months ago to reduce my high cholesterol, which is now gone. Congratulations. I heard that a whole food plant-based diet helps with inflammation and arthritis pains. What whole food plant-based foods should I avoid? I'm not seeing results.
Not seeing results in terms of the arthritis? Is that what she's referring to?
It sounds like the high cholesterol has been reversed, but the inflammation and arthritis pain perhaps has not.
Well, yeah, certainly. I'm sorry to hear that. Obviously, there's multiple different causes of joint pain and arthritis. And so certainly adopting this whole food plant-based diet is very good for this individual's health. It is possible that there's some other, maybe it's an autoimmune cause or other possible causes that may be contributing to this individual's joint discomfort. So I would really encourage her to follow up with her primary care doctor and perhaps see a rheumatologist to have more of a thorough workup to discern, are there other possible contributing factors. That certainly the diet is important, but it may not be the only thing that can help reverse this problem. I'd also make sure that her vitamin D level is checked. We know that individuals with vitamin D deficiency may be prone to joint pains as well.
100%.
Michelle, what do you think?
Yeah, 100% agree. And also I think that's so important as well. Sometimes I see patients where, I talk a lot about lifestyle, but then they'll say, well, I did all of these things and I'm still having vaginal dryness. And that's one of the things I always want to get across to patients is all of these lifestyle behavior changes are wonderful. And yes, I believe you should do them for so many reasons, but sometimes there are underlying problems or things that cannot be reversed or fully addressed with lifestyle alone. It doesn't mean that lifestyle changes are not beneficial. Keep doing them. They help most, a lot of our chronic conditions. However, it's really important to stay in close connection with a healthcare provider who can help you look into things, because sometimes there might be another thing that hasn't been explored yet. yet, or where you need some additional help or treatment.
Yeah.
Great, thanks. So I don't know if you guys know this, but almost every guest on Chef AJ Live gets asked the famous, what do you eat in a day question? And since you're running marathons, Dr. Comander, I'm very curious how you fuel your workouts.
So they want to know what I ate for breakfast, for example.
Yeah, just, absolutely. You got to catch up with the show. Almost every guest gets asked this
Well, my
question.
morning did start pretty early. I won't go into all the reasons why, but this is one of the good reasons why. So first of all, I love my coffee. So I did have that. And I love oatmeal. So that's like one of my favorite breakfast foods, whether I make it so it's ready in the morning in one of those like Instapots or something like that, or if I just make it first thing in the morning. And what I love about oatmeal, you can use a plant-based milk such as almond milk or soy milk, and then you can add yummy things to it to give it more flavor, such as raisins or dried cranberries or a little bit of dried coconut. And it's just such a delicious, hearty breakfast that has so many important nutrients, fiber, etc. And it definitely is great fuel for a run. So I can't say I always have it before a run. Sometimes I actually have it after I run, but that's one of my favorite breakfasts. And do you want to know my lunch?
Yeah, absolutely. And
Well,
your
lunch
dinner
on
and
the week,
your
it's a
snack.
little different, but during the week, I'm sure you've done shows on meal prep. That's something I always love to teach my patients about, because I feel like if we get good at strategic ways to prep meals for a busy week, we're all more successful with our diet. So usually on Sunday nights, I do my best to make a bunch of salads that I will take to work. I'm really busy in the hospital. I don't usually get a lunch break per se. I am sadly one of those people eating at my desk, but I'm eating a healthy salad. So I make a really healthy salad with spinach and lots of they look very beautiful. In fact, I usually bring them to my husband. Look at my salads. And then I feel bad that I didn't make one for him, but that's usually what I have for lunch. And often with tofu that sometimes I just have to cut up the tofu and throw it in. Sometimes I bake it and put some seasonings on it, whatever I have time for. But that is my lunch. I have it every single day. And then dinner really depends. You get home from work and it is usually healthy because that's important to me, but it's sometimes rice and beans, something simple like that. Sometimes it's a stir fry, depends. But that is a typical day. For snacks, I love almonds, cashew nuts, that type of thing. I would love to hear what Michelle eats during the day.
Oh, so I love oatmeal as well. I usually get a smoothie in because I'm not, sometimes I'm just so busy or don't have time to throw a salad together. So I usually try to do a smoothie every day that has some kale in it, some berries. Sometimes I'll throw in some mango, just depends on what I'm doing. I try to put some flaxseed in it as well, usually some soy milk, sometimes a date in order to get it a little sweeter. So I like my smoothies, and it's a good way for me to get in some kale or to get my greens in every day. I love oatmeal as well. Snacks, walnuts are my favorite. Walnuts and some dried fruit is kind of my go-to, as well as like the pears have been amazing lately. So fresh fruit is really my go-to. I've really been enjoying baba ganoush lately. I was at our children's museum and actually took a class where my kids got to make baba ganoush with me, and I realized that they loved it. Like, who would have known? So eggplant. So we've been doing that lately as well. And then yeah, I rotate different things for dinner. We try different things and try to do some meal prep well.
Love it.
Great. Renee is asking about, you mentioned about estrogen, and she's saying she's worried because she's a cancer survivor. Should they be careful if they have had cancer using estrogen?
I presume she's referring to the vaginal estrogen.
Yeah, the vaginal estrogen.
So I will say, and Michelle, I want you to chime in too, but certainly when my patients are seeing me and experiencing symptoms such as vaginal dryness, discomfort with sexual intercourse, these symptoms are unfortunately quite prevalent. And I will say it's very important for individuals to bring this up with their doctor so we can discuss and be aware and offer solutions. So often we will try one of these sort of non-hormonal vaginal moisturizers that Dr. Tollefson noted. There are many of them out there, such as, there's just so many of them out there. Replens comes to mind, but there's many options. And if that is still unfortunately not solving the problem, we do have data from our professional organizations, such as the American College of Obstetrics and Gynecology, American Society of Clinical Oncology, that vaginal estrogens do appear to be safe when used in breast cancer survivors to help address this problem. There may be a small amount of systemic absorption of the estrogen, but generally it is felt to be safe. So if I have a patient who is particularly symptomatic, I will discuss, with her gynecologist this option, and we do feel that it is safe, and this is quite accepted at this time. And of course, I'll talk about the dietary recommendations that Dr. Tollefson mentioned earlier. Feel free to chime in further, since this is an area of great expertise to you as well.
No, that's perfect. Thank you.
Are you training for any marathons currently, Dr. Comander?
It's a long story I won't bore you with. I was going to be running New York City. I might have to defer it for a number of reasons, but I'll definitely do a half marathon instead. But I do Boston every year. I'm in Boston, so it's not a big challenge for me to do it, except for the training during the winter. And I run it for charity each year. So this year will be number 10 for me. So I'm really excited about that. Not the winter training so much, but
you run every day, even when it's like snowing?
Well, I'm trying to practice what I preach. And in the PAVING program, we very much preach, yes, aerobic physical activity is so important, but the strength training component is also key for our bone health, for our muscle health, for our brain health, for hot flashes, as Michelle noted. So I'm really making a strong commitment now to do strength training at least 2, sometimes 3 times a week, in addition to the running. I know it'll help my running and help me overall with my fitness. So I'm actually enjoying it so far. I found a group of women, by the way, that meet a few times a week for this boot camp to get into strength training. And again, getting back to the power of social connection, I feel like being in a group has been really helpful to me.
Great, thanks. So Dave says, my wife uses OTC, I guess that's over the counter, estrogen. Is that okay to use?
I guess I'm not sure what is in estrogen, so I don't know. I'm not sure if it's a vaginal moisturizer, if there is, with the word estro, and I'm guessing that may have a hormonal component, but if it's over the counter, so I guess I can't comment on that. Do you know about estrogen, Amy?
Yeah, it does ring a bell. I tell all of my patients with any supplement, even if it's over the counter, to bring it into a clinic visit so we can look at the ingredients together. I will say a lot of these supplements, even though they're sold over the counter or online, are not necessarily regulated by the FDA. So it's really important to understand what is in there, what are the ingredients. That one I've definitely heard of, but off the top of my head, I can't remember the specific ingredients. But I'm very skeptical of all of these things, I have to be honest. So I really would want to dive deep into what's actually in that supplement.
And I 100% agree. There just isn't the oversight that there is for, like, say, prescription medications. And even though we think, well, usually everything will be safe, but sometimes they found that there's actually really high concentrations of whatever they're advertising is in the product, and even sometimes things that aren't in the product. And so it gets really complicated when you have various supplements and herbal remedies. And so it's really important for you to take that to your doctor and to be open. There's some research out there showing that patients often don't disclose that, and that just is a danger, and I think a disservice to them. So I would encourage you to talk about that with your provider. And there's some different resources where they can look up information. If they aren't aware of the ingredients or what's in it, they can do that research and assist you.
Nice. Do either of you see patients either in person or virtually?
Well, I am, a breast oncologist, so I very much am back in full gear. Most of my visits are in person, but we still do some telemedicine visits. Again, I think that is a positive thing that has come out of this very challenging past two and a half years that we've been through now with the pandemic. So the telemedicine's really taken off and actually provided us with this platform to be able to do the PAVING program in a virtual format. So that's really my main job, although PAVING is my passion. And I'm really excited to work on it further with Michelle and Beth.
Sure. And I stopped delivering babies and doing surgery about 15 years ago, when I stopped being a full-time OB-GYN and became faculty at Metropolitan State University of Denver and started their lifestyle medicine program, where I'm currently a professor. But then I volunteered at a nonprofit clinic for years doing lifestyle medicine for women, where I would see them for vaginal dryness and menopausal symptoms. And so I still volunteer there a minimal amount since the breast cancer diagnosis. And then with COVID, I haven't come back as strong as I was planning on the one-on-one visits, but I felt like PAVING and working on these books was really calling to me. And I feel like I can help more people. in that way. So I don't know if I'll go back to doing more at this nonprofit clinic or not. Time will tell, but I hope I can reach as many people as possible through the group, maybe some group Zoom paving groups, and then the book.
Nice. If people, do either of you have a social media presence if people wanted to find out more about you or follow you?
Yeah, I think we're both on Twitter. You can look us up. I'm at Dr. Amy Comander. Michelle, I forget what yours is, but I know you're on there too.
I need to be better about it. I think I've only posted a couple of things. So yes, I am, but yes, I'm not very active. And I know Dr. Beth Frates, though, our
very much on there.
She is very much on there. So yes, check her out as well. And then also Paving Wellness. We are out there. I need to look up our Twitter. Is it called a handle? I'm showing my lack of knowledge.
I think it's at Paving Wellness. So we do, as you noted, have a Twitter account, and we have an Instagram account, Paving Wellness. And I have a burgeoning Instagram account too, at Dr. Amy Comander. So I'm trying to post more information about lifestyle medicine and cancer, but certainly lifestyle medicine as it relates to all of our health. So, and this is something, we're all super passionate about, helping spread this important information to help as many people achieve a healthy lifestyle.
Well, great. Well, thank you guys so much for your work. It was a pleasure meeting you. Oh, I was going to say goodbye, but Dave says the three primary ingredients of estrogen are black cohosh, soy isoflavones, and rapontic rhubarb extract.
I don't know if Dave, who is posting this question, if he was referring to the person he was referring to is taking this, is she a breast cancer survivor or not? Because sometimes I'm careful with these concentrated soy isolates in various supplements. And I see Michelle nodding to soy from whole foods. We generally think is a safer approach, as Michelle mentioned earlier, but these concentrated isolates, that makes me a little nervous, to be honest. But if she does not have a history of breast cancer, I mean, it might be okay, but I still favor soy from whole foods. And Michelle, do you agree with me on that one?
100% agree. Yeah, there's been research showing that some of the soy supplements or the soy isolates, that the concentrations can be much higher than advertised. And we don't, I think, fully understand what those soy isolates can do when they hit those estrogen receptors. I think we need more research there, but I know that, but I do believe that we have enough research to show that when we eat phytoestrogens in that whole or minimally processed food form, that there's tremendous benefit in that the interaction with the receptors is positive. So
he says she's an ovarian cancer survivor.
Ovarian cancer survivor. So, so certainly menopausal symptoms are obviously of great importance for this individual. She should check out the book. Sorry, I had to say that, but if she's using it to help manage hot flashes and that type of symptom, I think some of the strategies that Michelle outlined earlier are really helpful. I would be still a little nervous about this soy isolate, which I'm not really sure exactly what that is. And I would encourage her to try some of the other lifestyle measures we talked about. And there are other medications, by the way, that can be prescribed to help address hot flashes if that's the primary reason that she's taking it.
And I 100% agree. I would say talk to the gynecologist or talk to our primary care provider, because there are other non-hormonal options maybe that could be used. So I would encourage her to reach out too. For sure.
Great. Well, thank you guys so much. It was a pleasure spending this Saturday morning with you.
Thank you. It's been
thank you so much.
Thank
you so much for the invitation.
My pleasure. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow when my guest is Julie Piat. You may know her as the wife of Rich Roll, and she has a company now that makes fabulous vegan cheeses, and she'll be doing a culinary demo.